I'm a little bit in shock because the last room was green and now it's pink, and I think you're preparing me for Wicked, and I'm very excited. I'm a musical girly, so I'm very excited. But let's start again. Half a day. Half a day, and welcome to the office of the Governor of Guam, Biba Betness. We are here this beautiful Friday morning to proclaim October as Breast Cancer Awareness Month. Before we begin, of course, I do want to recognize the presence of the Honorable Joshua F. Tenorio, our acting governor of Guam. From the 30th Guam Legislature and your Oversight Chair for Healthcare, Sabrina Salas Metanani. Also have the Adjutant General, Mike Cruz, Dr. Mike Cruz. Chief of Police, Steve Ignacio. And quick, I just want to draw your attention to his patch on his sleeve. The pink patch is in honor of Breast Cancer Awareness Month. Also want to bring your attention to Joe Carbolito. Half a day. Let's give him a round of applause. Now from the Department of Public Health and Social Services, our acting director, Peter John Camacho. our deputy and former Senator Amanda Shelton. Our Chief Public Health Officer, Catherine Nkao. Keep those applause going for the Bureau of Non-Communicable Disease, our acting BNCD Supervisor, Elizabeth Guerrero. Hi, Liz. Also want to recognize the Guam Breast and Cervical Cancer Early Detection Program. Yes. The Tobacco Prevention and Control Program. Diabetes Prevention and Control Program. And the Hypertension Prevention and Control Project. Again, this is all for the NCD team. I also want to recognize the Guam Comprehensive Cancer Coalition, Luis Borja and Angie Mummer joining us. Former senator, of course. Community Health Centers also joining us, our acting CEO, Abraham Mora. Abe Mora. Abe. I do also want to recognize Guam Cancer Care, Jessica Rosales. Half a day. American Cancer Society, Marisha Artero. Half a day, Marisha. Guam Cancer Registry, Naomi Del Mundo Park. I love saying this one. Breast Friends Forever, Mae Bloss and Rose Clark. Half a day. Very clever name there. Also want to recognize our Payless Markets Community Foundation, Circle of Care Cancer Support Program. Marie Benito and friends. Yes, thank you so much. Seroptimus International, Guam, Ann Roth and Arlene Berdalio. Half a day. The Guam Radiology Consultants, Dr. Pichi Pacheco Piana. Half a day, Doc. FHP Health Center, Rose Greeno and Jerry Patricio. Half a day. MDX Imaging Center, April Rose Mills. Keep those applause going. Don't let the energy wane. Guam Regional Medical City, Charlona Laron. Half a day, Charlie. Phil MD St. Luke's Medical Center, Annette Garces. Half a day. Miss Annette in the back. Another one I like to say, save the Susu, Guam. Half a day. And thank you so much for joining us this morning. Seventh-day Adventist Clinic, Ruth Kamet and Liza Lynn. Also want to recognize from our Public Health Lab, Ms. Anne-Marie. Half a day. Our former DPHSS director, and he's now an advisor for our governor, Art St. Augustine. Also want to recognize territorial epidemiologist Patrick Soto. And we can't miss her. We actually know her. She's probably wearing a different hat today. Maria Pangilinan from the Guam Election Commission, but she's also our cancer warrior. Oh, she's in the back. Miss Maria, can you stand up? I can't see you back. Stand up for a second. Yes. And can I have all the cancer warriors stand up as well? Warriors? Cancer warriors? Yes. Miss Maria in the back. Yes, thank you so much. We are here today because of you. Thank you. And now we'll go ahead and start our program with remarks led by our Deputy Director, Ms. Amanda Shelton, our former Senator.
Sejus Masi Crystal. Good morning, Acting Governor Tenorio, Senator Sabrina Salas Metanani, and all of our distinguished guests here, especially our breast cancer warriors, families, and caregivers. Thank you for being here today. It's truly an honor to stand with you today as we come together to proclaim October as Breast Cancer Awareness Month, a time to unite in hope, raise awareness, and champion early detection for the women and families of Guam. Breast cancer remains one of the most pressing health challenges for women on our island. According to the Guam Cancer Registry, from 2018 to 2021, 265 cases of invasive breast cancer were reported, and each year we lose an average of 7 women to the disease. What's especially concerning is that 35% of these cases occur in women under the age of 55, reminding us that breast cancer does not wait for later in life. It can affect women in their most active and productive years. But there is hope. Data shows that more than 60% of breast cancers on Guam are detected early, when treatment is most effective. This progress is due in large part to awareness campaigns, community education, and the tireless work of our health professionals, especially the ongoing efforts of the Guam Department of Public Health and Social Services. Through its breast and cervical cancer early detection program, the department provides free or low-cost mammograms and clinical breast exams to eligible women across the island. The program also helps women navigate the healthcare system, from screening to diagnosis to treatment, so that no one is left behind due to cost or access barriers. And in partnership with the Guam Cancer Coalition, nonprofit organizations, and community clinics, DPHSS continues to bring life-saving education and screening services into villages and workplaces. This year's theme, Feel for Lumps, Save Your Bumps, delivers a simple but powerful message. Take charge of your health. Regular self-exams, clinical breast exams, and mammograms are key to finding breast cancer early, often before symptoms even appear. To the women of Guam, your health matters. Please take time for your screenings, know your body, trust your instincts, and don't ignore any changes. Whether it's a lump, pain, or change in skin, early action can save your life. And to the men and families of Guam, your support matters. Encourage the women in your life to get screened. Be part of the conversation, because when one person is diagnosed, it affects the entire family and community. Breast cancer is not just a medical issue, it's a community issue. It touches mothers, daughters, sisters, friends, and coworkers. When we all come together, government, healthcare, employers, and families, we create a stronger, safer awareness community with compassion and care. As we observe Breast Cancer Awareness Month, let's renew our commitment to education, early detection, and access to care for every woman on our island. Let's wear pink with a purpose, talk about breast health openly, and continue to spread the message loud and clear. Early detection saves lives. Together, through awareness, action, and support, we can make a lasting difference in the fight against breast cancer. Siduos Masi.
Cesar Masi, Deputy. And now I want to give the microphone to Colonel Mike Cruz, board certified surgeon, fellow American College of Surgeons, Adjutant General National Guard, Executive Director, Blue Cotton Healthcare Guam, affiliated with Guam Radiology Consultants. We'll talk on availability of breast cancer treatment on Guam. That's what it says here, Doc. May we pass the microphone to him? Yes. Take it away.
You know, I wasn't aware I was going to be speaking about that, but I will talk anyways. As many of you guys know, I am a physician. Many of you don't know that I actually am a surgeon, but more specifically, I'm a breast oncology surgeon, a breast cancer surgeon. And my journey into breast cancer starts at a very early age when my mother was diagnosed with a very aggressive stage 3 breast cancer when she was only 38 years old. And this was during my first year of medical school. And so this really dictated my pathway as I went into medicine. I have been so interested in breast cancer that I'm a charter member of the American Society of Breast Surgeons as well. My mother, diagnosed at a very young age, back then, had very little options as to treatment. And she had a total mastectomy. What is, but the good thing is that she survived, and she only a couple years ago died from a stroke. In other words, notwithstanding the very aggressive disease that she had, she survived. Death, breast cancer is not necessarily a death sentence, especially today with the screening that we have, with the treatment modalities that we have at all the different cancer centers here in Guam. It can be treated. My younger sister was diagnosed with breast cancer as well, early stage. My mother-in-law and my mother-in-law's sister were diagnosed with breast cancer as well. I'm also wanting to let you make it right here. And it's appropriate that the police are wearing blue and I'm wearing blue and some of us are wearing blues because you need to know that 1% of breast cancer are found in males. So even as we say women, but honestly, in my 35 years of doing breast cancer surgery, I have done 3 male breast cancers. Interestingly enough, it's the males that had the most pain post-op after the operation, and not the women. But here on Guam, so that all of you know that we now have the ability to take care of all that we need to do for breast cancer, from screening, from the mammograms and the MRIs and everything like that, to include the chemotherapy, the radiation, and everything afterwards. So there's not necessarily a need to go off island for that. And especially when it's for treatment of cancer, it's cancer treatment typically takes a long time, right? And I had a 2-year-old daughter who had cancer when she was only 2 years old. So my wife had to live off island for almost 6 months as she went through the chemo and radiation for that. So it's best when you have the support, the family support that you have here in Guam. It makes it easier for you and comfortable. So you can rest assured that although there is some concerns about healthcare in Guam, I can tell you that as far as breast cancer is concerned, we've moved a long way. So I know I have some of our breast cancer warriors that I happen to be privileged to have been able to take care of, and Maria is one of them. So I just wanted to say hi to her as well. So anyways, thank you for the opportunity to get a chance to address you. Thank you, Acting Governor.
Thank you, Doc. Before we proceed to our next speaker, yes, you can go ahead and give him a round of applause for sharing that and for saving lives. Before we proceed with our next speaker, I do want to recognize the presence of Dr. John Taitano. I saw him along the wall. Candace the White Coat. I also want to recognize the Executive Director for the Bureau of Women's Affairs, Ms. Jane Flores. And now to our next speaker, another doctor in the house, Dr. Picha Pacheco Piana, board-certified radiologist. She's affiliated with the Guam Radiology Consultants, and she'll be talking on the importance of early detection and battling misinformation from social media. That is what my script says, Doc. Go for it.
Half a day and good morning, everyone. It's an incredible honor to be here today surrounded by breast cancer survivors, warriors, families, our island leaders, and fellow healthcare professionals, all gathered for one shared purpose, to fight breast cancer. For the past 7 years, I have served the people of Guam as a diagnostic radiologist with a focus on breast health. At Guam Radiology Consultants, I lead our breast imaging center with our team right behind me here, where each day we read screening and diagnostic mammograms, ultrasounds, and MRIs, perform biopsies, and most importantly, guide women through the often emotional process of understanding their biopsy results and connecting them to the right doctors for treatment. In many ways, I've come to see our job as breast radiologists as a primary care physician for breast. Patients come to us not just for imaging, but for answers, for reassurance, direction, and advocacy. It is deeply personal work because every image represents a mother, a sister, a daughter, a friend, and as a homegrown physician, I do not consider this as just my job, but as a calling to care for our people. Every day, I am reminded that screening mammography saves lives. It allows us to detect cancers years before they can be felt or show any signs of symptoms. I have witnessed women whose cancers were found at the earliest stage who responded very well to treatment and are alive, thriving, and cancer free today, some of whom may be in this room today. But I have also seen the heartbreak of late diagnosis when fear, misinformation, or financial barriers delay screening and workup until the disease has already advanced. That contrast fuels my passion because in breast cancer, time truly matters. When caught early, the 5 year survival rate exceeds 99%, and that number represents hope. And that hope begins with a screening mammogram. One of the biggest challenges we face today is not the lack of treatment or lack of technology in Guam, but the wave of misinformation spread online. The internet has connected us like never before. It's made it easier to share stories, support one another, and learn. But it's also given anyone the ability to sound like an expert, even when they're not. That is why I remind all of us to be careful who we listen to. Before believing what we see on social media, please check the source. What are their credentials? Are they a real medical doctor or just claiming to be one? Your main source of information should come from your trusted physicians, your primary care doctor, breast radiologist, surgeons, your oncologist. These are the people who are qualified and trained to guide you with evidence and compassion. Because when it comes to your health, trusting science and truth can literally save your life. On social media, I regularly encounter posts claiming that mammograms cause breast cancer, that biopsies will make breast cancer spread or make it worse, or that if you don't have a family history of breast cancer, it's okay. You don't need to get screening, or if you don't feel anything, it's okay. You don't need to get screened. These myths are dangerous and they create fear, confusion, and delay. Let me be absolutely clear. Mammography does not cause breast cancer. It uses a carefully regulated, very low dose x ray designed to maximize early detection of breast cancer while minimizing radiation exposure. It is roughly the same amount of radiation as 1 to 2 months of natural background radiation just from living on Earth. It is also about the same as the radiation you would get approximately 8 to 12 flights from New York to LA. There are some people on social media who are touting other exams, such as thermograms, to be as safer or, quote, better than mammograms. Please know that these claims are baseless and unproven. In fact, FDA has issued a warning against using thermography for cancer screening, stating that there is no valid scientific data to show that thermography devices are an effective screening tool for any medical condition, including breast cancer detection. The FDA stresses that mammography is the only screening method proven to reduce deaths from breast cancer through early detection. These misconceptions in social media are the reasons why I will keep speaking up. Because when it comes to breast cancer, truth saves lives and not trends. When screening mammography is completed every year, starting at 40 years old, your risk of dying from breast cancer decreases by 40%. And that's why we recommend routine annual screening for every woman 40 and older because breast cancer doesn't discriminate. It can affect anyone, regardless of age, lifestyle, or family history. In fact, 75 to 85% of women diagnosed with breast cancer have no family history at all. If you're 25 years old or older, please talk to your primary care doctor about your personal risk. Some women may need to start screening earlier. Another important myth I would like to debunk is that biopsies cause cancer to spread. That is simply not true. It's a dangerous misconception that has led some women to delaying getting the care that they need. A biopsy does not make cancer worse. It helps us find answers. It is a safe and essential step that allows doctors to confirm a diagnosis so that treatment can begin as soon as possible. The biopsy is not what spreads cancer. It's what starts the path toward healing. Another important conversation I would like to address is about breast density. Nearly half of women have dense breast tissue, which can make it harder to detect small cancers on a mammogram. For these women, it is important that they complete not only annual screening mammograms, but also supplemental imaging with breast ultrasound or MRI depending on their risk. These additional exams can find cancers that mammograms might not see. But unfortunately, not all insurance plans cover them. And this creates inequity. Women who can afford imaging get it, while others just go without. And I am calling on our policymakers, local insurers, and healthcare partners in this room today to help us remove these barriers. If we truly believe early detection saves lives, we must make sure every woman on Guam has equal access to these life-saving tools. None of the work we do in battling breast cancer happens in isolation. I want to express my deepest gratitude to those who make early detection possible, the Office of the Governor and the Guam Legislature for your efforts in improving women's health, Guam Public Health for your tireless community outreach and patient navigation, and especially the Guam Breast and Cervical Cancer Early Detection Program, a vital grant that empowers radiologists like me to do what we do best: screen, diagnose, and guide women to timely treatment. Because of this program, countless of women who might have otherwise go unseen are being reached, are being screened, and are saved. You are helping us bridge the gap between access and improved healthcare outcomes, and for that, I am profoundly thankful. When people ask me, how do I do this every day? I tell them it's not just about reading images. It's about touching lives. Each mammogram I interpret represents someone's mother hoping to see her child graduate, a grandmother waiting to hold her first grandchild, and a daughter who just wants to know that she'll be okay. And those faces and stories stay with me long after the images leave my screen, and they remind me why I chose this path. And I'm always humbled every day. And that's why I stay committed to our island. The women of Guam deserve the very best care that they could get: evidence based, compassionate, and accessible to all. Because breast cancer doesn't start and stop in October. For the patients who are affected by the disease and for the healthcare workers who walk with them through it, this is our day to day life. It's not just 1 month of pink ribbons, it's every day, every year, every life touched. And I encourage all of us to keep raising awareness beyond October, because breast cancer education should really be year round. So as we sign this proclamation today, let it be more than just a ceremonial gesture, and let it be a call to action, a call to invest in our screening programs, fight misinformation, support laws that expand access, encourage every woman to get her mammogram, and provide ongoing care and resources for those who are actively fighting breast cancer and for the survivors who continue to need our support. To my fellow healthcare workers, keep advocating, keep showing up, and keep being the voices that our patients can trust. To our lawmakers and our leaders, keep listening, keep supporting, and keep making women's health a priority. And to the women of Guam, don't wait. Get screened. Your life, your dreams, and your future are worth it. Early detection gives us choices, it gives us time, and most importantly, it gives us hope. To the health professionals, leaders, survivors, families, and the brave women who continue to fight this disease, let us stand together, united in one purpose: to ensure that everyone on this island has a chance to detect breast cancer early, receive care promptly, and live a long, healthy, and hopeful life. Siduus Mausi for your time, your partnership, your unwavering commitment to this mission of truth, healing, and early detection. Thank you.
Sisui Smasi Doc. I now want to give the floor to for data collection specialist Maria Manuel.
Thank you. Hafaday, Acting Governor, members of our legislature, colleagues, family and friends, and survivors. Thank you to the coordinators for inviting the registry to speak about breast cancer on Guam. My name is Maria Manuel, and I will be speaking on behalf of the Guam Cancer Registry today. For over a decade, breast cancer has been one of the top 5 cancers in Guam, and it is the second leading cause of cancer death among women. During 2018 to 2021, a total of 265 invasive breast cancer cases were reported. On average, 66 women are diagnosed with invasive breast cancer, and 23 women are diagnosed with in situ breast cancer each year in Guam. An average of 7 women die each year in Guam from breast cancer. 35% of breast cancer cases are diagnosed in women younger than age 55. Breast cancer incidence and mortality rates are highest among Chamorro women. We are seeing a slow but steady increase in cases of breast cancer, but the good news is they are being detected earlier. According to the World Health Organization's Global Breast Cancer Initiative, the first goal is to have over 60% of invasive cancers diagnosed at stage 1 or 2. In Guam, 62.5% of these cancers are diagnosed at early stages as in situ or localized. We must continue to advocate for early detection screenings. The earlier cancer is found, the higher the chances are of surviving and beating cancer. Screening saves lives. I would like to thank my colleagues, our community partners, acting governor, and members of legislature for their continued support. If you'd like more cancer information on Guam, you can visit our website at www.uog.edu/research/Guam-cancer-registry. Thank you.
Jesus Masi Maria. And I want to call her to the podium. She will provide testimony. Miss Alicia Guy King, Administrative Assistant for Chief Public Health Office. And more importantly, a breast cancer survivor.
Thank you and good morning, everyone. I am Alicia Gaiking, Administrative Assistant working with Chief Public Health Office under the Department of Public Health and Social Services. I am a testimony of an early detection program. So I had my first mammogram in early July of 2003, because I was turning 41 that year. So I had my first mammogram because I had so much pain on my left breast. So the mammogram was done in SDA clinic. Sure enough, the result is not good. So they are finding something from that mammogram. So I was referred to do a biopsy at Guam Radiology Consultant. So I did that, and it was found out that I have the early stage cancer of the breast. So I was automatically referred to a physician or a surgeon to do it soon because of the fear of spreading it all over my body, because it's a cyto microcalcification. So I went to a surgeon, but he wants it to be done like outpatient. So I said, it's gonna be very hard for me because I don't have family here in Guam. So I said, maybe I would like also to get a second opinion. I went back home to the Philippines where my family is, so I can get also their support while I'm undergoing treatment or procedures. So I went back home, I did the same biopsy test at the St. Luke's, and sure enough, the result still the same. So I was convinced I had to do the procedure soon. So I had it at St. Luke's. I stayed there for 1 week, and it was a successful surgery. And then after that, I have to go visit the oncology every month to do a follow-up. But what's good thing is because it was caught early, I don't have to undergo chemotherapy. I don't have to undergo radiation. They just gave me oral medication for 5 years. So every month I have to go to the onco for follow-up. I stay there with my younger children. My children during those ages were only Two are in elementary, and one is just less than a year old when I was detected. So we have to stay there for a while and then came back here, continued my medication for 5 years. But the one other miracle that happened to me in the middle of my medication, even I asked the OB, what is um, the possibility of getting pregnant? So she told me 99.9% you cannot get pregnant because of the medication you're taking. But after 2.5 years of taking the medicine, I didn't know that I'm already pregnant. So 2 months already, 2.5 months, I said, my tummy is getting bigger. I cannot zip up my jeans anymore. So what's this? So I was so curious. So I went to the OB and said, can you check me up? Because I'm not sure what's this, that I'm getting bigger. And then at first they tried to touch my tummy, but found nothing. So they said, maybe we should do ultrasound. Okay, they did the ultrasound. Oh my gosh. My baby is already 2.5, alive and kicking inside of me. So, and 2 months already, I've been taking medication. I didn't stop because I didn't know I'm pregnant because I don't have symptoms of pregnancy. So after that, I went to the OB, of course, to my OB to have my prenatal checkup. So they were saying, okay, um, they found out that I was on medication. So they said, can you come back? We need to consult other physicians regarding my situation. I guess it's their first time to encounter. So we came back, my husband and I came back, and my doctor said, my OB said, I think we suggest we stop your pregnancy because of the fear of the abnormality of the baby because I've been taking medicine. But of course, because we believe God and we really have that much faith that He is a healer and He is a miracle worker. So we told our OB, no, we're gonna keep the baby. We're gonna pray for the baby. And for sure, yeah, she will be okay later on. And that's what we did. From the time I found out I'm pregnant, every single night before we sleep, we pray for that baby until I give birth. Every single day until I give birth. So finally, time to give birth. I got C-section because she turned around 2 days, 2 days before my delivery. And then, yeah, it was so surprising. The OB might think also is so surprised that I gave birth to a very healthy and baby is almost look like 1 month old already. She's big and rounded. So yeah. So now she's already 19 years old. She's very normal. Yeah, and she's active. Yeah, so I said that really early detection helps a lot. And I believe that it's also with the miracle working power of the Lord that help us go through with this. Yeah, and I really, this is really my life testimony. And I thank you all for listening.
Thank you so much, Miss Alicia, for sharing your story with us. I'm sorry, Acting Governor, that's a tough act to follow. You have the floor now.
Thank you. Good morning, everybody. Such a privilege to be here. And as you heard from the earlier speakers, we're really gathered here to give give a big opportunity, big push to get our people informed about this cause of breast cancer awareness and recognizing that there's just so many people and programs and opportunities at all stages of this issue. I know that the Bureau of Women's Affairs does a lot of work educating girls in school, right? And of course, sometimes the best place to start getting our people to be caught up to speed is at the very youngest of the ages, and understanding that this is not 100% a women's health issue. It is a dominant women's health issue, but we heard from our good friend Dr. Mike that there are occurrences where this can happen with men, and recognizing that the earlier you get screened, the earlier that you can intervene, you can ensure that a path to recovery will be pursued. And today, we get to recognize the vast number of people that are here to work on the behalf of people that are battling this disease, people who have survived, but to really try and focus on people to make sure that we could ease the path that many unfortunately had waged before. As Dr. Mike said, you know, in the early part of this, the survival rate was much lower. We're fortunate that we have technology and that we have robust programs and services on island so that people, women, and those few men can recover with the comfort of their family, with the confidence of a healthcare system that has the expertise, that has the resources to push back so that we can ensure victory for those that are being diagnosed with the breast cancer. I want to recognize and thank the officers of the Guam Police Department for the leadership in recognizing that this is a community call to action. We come from a matrilineal society, and you heard the data and statistics. Chamorro women have the highest occurrence of breast cancer on Guam. That is an alarming call. That means that we have way more work to do to bring education and to bring information to our homes and to our families, to make sure that they are armed with the information and they have access to healthcare providers and access to screening. And the screening can be done with community partners, not just a healthcare provider, but a community partner that can be a pathway to a trusted provider. This morning, we also talked about the dangers of social media. Unfortunately, right now, there's a lot of discord and discussion about the causes of various kinds of health ailments. And a lot of authorities or those that are posing as authorities trying to give instruction to people. And so the reminder here is to recognize and refer to your trusted healthcare provider, get their guidance, and to celebrate that we have these providers and this system, this support system on island here in Guam. Finally, I want to recognize that this is a regional effort. I've seen people from PIHOA that are here, Pacific Island Health Officers Association. This is a cause that we take not only for our island, but for the entire region, given our location and the role we play in regional healthcare. So this morning, I want to thank the coordinators, public health, and the people in the community for providing us with this opportunity to really put a razor focus on this very, very important issue and to celebrate life, to celebrate how we can embrace life and we can guarantee life with all the tools we have in Guam. Sidus Masi.
Jesus Masi, Acting Governor. And now for the reading of the proclamation. Our reader today is April Rose Mills, Director for MDX Imaging Center.
Thank you. Proclamation number 2025-104, a proclamation of the governor proclaiming October 2025 as Breast Cancer Awareness Month. Whereas every October we come together as a community to observe Breast Cancer Awareness Month, standing in solidarity with individuals and families affected by breast cancer, not only on our island but across the nation, to raise awareness, promote early detection, and support those fighting this disease. Whereas breast cancer does not discriminate, and our island is no exception. Every year, an average of 66 women are diagnosed with invasive breast cancer, with nearly 35% of those cases occurring in women under the age of 55. Tragically, while 62.5% of those cases are diagnosed at an early age, the remaining 37.5% are caught at a later and unknown stage, making early detection and screening efforts even more critical. Whereas, on Guam, breast cancer remains one of the leading causes of cancer-related deaths, with an average of 7 women losing their lives each year to this relentless disease. Whereas, through the commitment and collaboration of local organizations such as the Department of Public Health and Social Services, the Guam Breast Cancer Early Detection Program, the Guam Comprehensive Cancer Control Program, and many others, Significant strides have been made in improving breast cancer treatment, early detection, and awareness. Whereas early detection saves lives. Countless women have survived and thrived thanks to the power of regular screenings, timely interventions, and increase in public awareness driven by outreach and education efforts. And whereas during this Breast Cancer Awareness Month, we honor the courage and resilience of breast cancer survivors and their families, while remembering and paying tribute to those whose lives have been taken by this disease. We acknowledge and express our deep gratitude to the advocates, healthcare providers, and researchers who dedicate their lives to fighting breast cancer, acknowledging knowledge, and providing vital support to those in need. We encourage every individual to take proactive steps toward early detection, support research, and advocate for health and well-being of those impacted by breast cancer.
Now, therefore, I, Joshua F. Tenorio, Octu Magetlahin Guahan, acting governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim October 2025 as Breast Cancer Awareness Month. Given under my hand, I cause a great seal of Guam to be affixed here in our capital village of Hagatna on this 17th day of October in the year of our Lord Anno Domini 2025. Biba Breast Cancer Awareness Month.
Thank you so much, Ms. April, and thank you so much to our acting governor. Now time for the group photo because we have so many people in the room today. We'll have the photographer come here. Our front row, you can actually turn around. So Jose will take your photo. Provide further